On April 23, 2025, the United States Department of Health and Human Services released the latest edition of the Guidelines for the Prevention and Treatment of Opportunistic Infections in Adults and Adolescents with HIV. These guidelines, focusing on opportunistic infections, have been continuously updated since 2009, with each chapter undergoing quarterly review by the Guidelines Committee. The objective of this guideline is to provide guidance to HIV care practitioners and others on the optimal prevention and management of HIV-related opportunistic infections for adults and adolescents in the United States. The sections on cystoisosporiasis, formerly isosporiasis, human herpes virus 8 disease, also known as HHV8, as well as Table 6 are what was covered in this update. Let's start with updates for cystoisosporiasis, formerly isosporiasis. The guidelines updated the epidemiology information, including adding new regions endemic for cystoisospora updated the diagnosis section, including new information on the use of polymerase chain reaction for diagnosing cystoisosporiasis, provided more detailed recommendations regarding the use of primary prophylaxis, and updated preferred and alternative regimens for treatment and chronic maintenance therapy. As for human herpes virus 8 disease, also known as HHV8, the guidelines provided more detailed information on diagnosing diseases associated with HHV8, updated recommended treatment regimens for Kaposi sarcoma, multicentric Castleman's disease, primary effusion lymphoma, and HHV8 diffuse large B-cell lymphoma, and added information on the treatment of Kaposi sarcoma inflammatory cytokine syndrome. Finally, Table 6 was updated to incorporate clinical discretion when adjusting doses of lamivudine and emtricitabine for renal insufficiency, now aligning with dosing recommendations found in the adult and adolescent antiretroviral guidelines from the U.S. Department of Health and Human Services. And there you have it. Make sure to check out the full guideline and other clinical tools from the United States Department of Health and Human Services at guidelinecentral.com.